Hi, welcome to the Nursing Professor. Today we're going to talk about stress and adaptation. And of course, as nursing students, I know that you all are feeling stress, but stress is okay. It either can stifle us, prevent us from moving forward, or it can actually help to motivate us. So, what do we mean when we're talking about stress? We're talking about any disturbance in a person's normal balanced state. So it could be something as simple as it's raining outside and your normal state is to walk to work, or something incredible like an earthquake or a hurricane or something that you have literally no control over. And so whenever our bodies are exposed to those types of events, there is a response that happens. And so we have to be aware of that, because that is what we're going to see with our patients. All right, so there are categories of stress that we need to be aware of. One is distress, meaning negative stress, things that we don't want to have happen, or eustress, which is good things, like the feeling you get with ice cream or a good meal or a good grade. Though that would be an example of eustress, because you're just so excited about it, it makes you feel good. And then we have developmental stress that happens in all of the various developmental stages that a person goes through. So when we think about an infant who can't communicate their needs very well to us, and so they go through a stressful state. Sometimes we call it colic, when everything the parent does to try to soothe them, it doesn't work. And many times I have to guess that that's because we're not satisfying whatever their need is. But as we progress in the developmental stage and we think about a toddler who now has to go to daycare, well, they go through stress. And pretty much every time they go to daycare, even if they are an outgoing child, because they have that parental separation that creates stress in them. And we can go on and on and on, thinking about puberty and how adolescents go through stress related to puberty, how young adults go through stress related to new relationships, how many of you all may be going through stress right now because you're balancing family, work, school, and all of those things like that. So stress is a part of life, but what we have to do is get to a point where we're able to cope with it. All right. And so we also have situational, time, and anticipatory stress. And when we think about situational stress, it's more unpredictable. It's like that distress that we actually have to deal with. So I would associate distress with situational stress. Time stress is can be distress, because you have so many balls in the air, so many things that need to be juggled, that you just can't find enough time to manage all of them. And then we have anticipatory stress, where we're forecasting what the future would be. And many of us like to live in that anticipatory state, which really does harm to us, because we don't know what the future is going to bring. You know, when you're sweating about what your test grade is going to be, you don't know what the test looks like. Maybe on the test, it's everything that you know, and you'll do well. So don't live in that state of stress. And that's exactly what we're going to teach our patients. So other categories of stress include those that affect us both physiologically and psychologically. So of course, when we're talking about physiological stress, those are things that upset our hormones, that have an impact on our physical state of being. For example, when we're stressed, our bodies secrete cortisol, which is one of the hormones that create inflammation in our bodies. And so as a result of that, then usually we don't feel well. We could have elevated blood glucose. We could have elevated blood pressures and things like that, because our bodies are so smart that it is going to show up as a response to all of those stresses. Then when we think of psychological categories of stress, of course that's going to affect our mental health, because none of us like to live in a state of being overwhelmed or having that state of increased pressure coming from every place, from our families, from our work, from our school, and all of that. So the thing is this, is that again, it's the same way we would teach ourselves, we have to teach our patients how to cope with that, because many of those things are what we have to contend with as a way of just living. Some of those stresses we just cannot ignore. So we have two ways of dealing with stress, and they include adaptive ways and maladaptive ways. So when we talk about adaptive methods of dealing with stress, we're thinking about those good things, those things of, say, maybe time management, healthy choices, healthy foods, getting some exercise in, getting some sunshine in, going for your physical exam and make sure that physically everything is okay with you, like you're not missing any one of the vital vitamins, like vitamin D many times is frequently low in people of color. And sometimes if your vitamin D level is low, then you will have problems retaining information. And so it could be something as simple as that. So we want to rule out, we want to make sure that our physical state of being is okay, such that we could just contend with those adaptive behaviors and encourage people to continue to have those adaptive behaviors. And the other thing to be aware of, it's okay to say no. It's okay to say no. You know, sometimes being a student and having a family and all those things like that, people are still going to request things of you. And sometimes the answer is no, I can't do that because I have other things that need to be done. So when we think of maladaptive or poor choices that people frequently make when they're under stress, and all of the time they're ineffective, are those quick fixes like drugs, alcohol, bad food choices, ignoring signs and symptoms of stress, like they might deal with a headache and they just continue to take Tylenol or ibuprofen, not really dealing with what might be causing them to feel that way. And so we want to discourage unhealthy lifestyles and help to encourage those things that may make our patient be able to cope better with stress. All right, so there are three general approaches to coping with stress, and they all depend on the situation. They depend if we can alter the stressor, like if we can make a change, because everything we can't make a change to. But if we can make a change to it, we need to make the change. For example, if our job is demanding us to work overtime and we don't have time to work overtime, then you might have to suck it up and you might have to quit that job for now or find another job. There's no reason to keep trying to negotiate something that's not going to happen. Adapt to stressors. That is what frequently we all have to do because we have everyday stresses, and many times we have to adapt to them and change our thought patterns about them being negative, because if you live in a negative space, you're going to get negative outcomes. And then avoid the stressor. So if something is creating that much stress for you, you need to just get rid of it. Whatever it is, get rid of it. Even if it's a pile of bills, get rid of it. Make it a priority to pay those bills and keep paying them down until you're down to a zero balance. And so many times the sacrifices associated with those things are not as easy as I'm actually saying it in this particular video. But these are techniques that we need to use to manage our own stress as well as teach our patients. Okay? All right, so it is possible to manage stress, believe it or not. And I know sometimes you all as students don't feel that way, but it's going to happen. You can't say it's not going to happen, so you have to deal with it. And so whatever your coping strategies are, then use them to the best of your ability. And if you find that you're having any troubles, then in most universities, there is some sort of counseling system there. You can go to student services, and you might need help. Sometimes you just need a listening ear for someone to hear what you're actually going through so that they can help you pull out those adaptive techniques from yourself. So when we think about adaptation to stress, we want to think of it like a teeter-totter, like a seesaw, and we want that to be as balanced as possible. It shouldn't be tipping over to the side where you're dealing with a whole bunch of stress, nor should it be tipping over to the side where everything is good, because when you're dealing with stress, then there needs to be an equilibrium that's there. So nothing is ever too good in life, and nothing doesn't have to be that bad at life. And so whenever we find that those stressors are tipping over, especially to the negative side, then many times patients will have health challenges. So for example, if a person has a lot of stress that they're unable to manage well and they have hypertension, then their blood pressure is going to be elevated. If they have diabetes, then their blood glucose is going to be elevated. If they are a person who suffers from migraines, they would tend to suffer more from migraines because the stressors do help exaggerate those existing symptoms. And so, of course, we want to minimize that. So encourage yourself, encourage your patients to have support systems in place. The hardiness of a person comes into place, like what their previous experiences were. If you come from a place where you've had a lot of stress in life, usually you're better equipped to deal with current stress because you've seen it before and you know that on the other side of it is a positive experience. Okay, so 2 things that we need to talk about as it relates to stress, and these are all related to pathophysiology. So if you remember, dig back, there was something called the general adaptation syndrome or gas syndrome. And that was Cilli's theoretical model of physiological response to stress. And so if you remember, he had the alarm system, fight or flight, or you could have an alarm system, you build up resistance, and then you were able to adapt. Or you had the alarm system, went to resistance, and then you actually went into exhaustion and died. So there was 3 different scenarios that could happen using the phenomena of the gas response to stress. So let's break it down a little bit. So first step was alarm stage. This is a stage where fight or flight comes into play. This is where a person is threatened by something that they need to escape and get away from it. So the body involuntarily responds. The body is like, no, I got to get away from this. So if there was a shooter in a classroom, then your body would go into that alarm state and seek a response where your heart rate's going to increase, your blood pressure is going to increase, your bronchioles are going to dilate to allow more air in because it wants you to run and get out of that situation. So that's why it's called fight or flight. And so it is our body's response to the alarm system. Now, just think about this. If we stay in that stage, how detrimental that's going to be to our physiological state. Because remember, I said your blood pressure is going to go up, your heart rate's going to go up, your blood glucose is even going to go up. And so if you stay in a state of where stress is putting you in the alarm state, then you're going to be very sick. And so we have to teach our patients how to manage it so that we don't stay in that alarm state. Okay? All right. So if we're not in that alarm state, then we think about the next state, and that would be the resistance stage. Okay, so it's the alarm state, fight or flight, then we'll go across and it'll be the resistance state. And so the goal of the resistance state is to maintain homeostasis. Again, thinking back to pathophysiology, homeostasis is where the body is seeking balance. So for example, if you're operating up here, the body says, I got to get away from it. Then the body's also going to let you get away from it, but then it's going to try to recover and get you back to the normal state where your heart rate starts to come back down, where your blood pressure starts to come back down, where your blood glucose starts to come down. Okay, so that is the resistant state where the body is trying to get back to a state of homeostasis. And with that, we will have both psychological and physical impact as well. Your vital signs will be one of the first things to respond to that as the body is coming back down to a normal state. So they would start to stabilize. If there is failure to adapt at that state, then we're going to go into exhaustion because our bodies are so smart. They can't operate like that for a long period of time. So if your heart rate is in the 150s, at some point, your heart's going to get too tired and it's going to conk out. And so we never want to get to the exhaustion stage. It's maladaptive, it's ineffective. So we want to stay at that homeostasis, that second stage of resistance versus going into exhaustion. And so if for some strange reason we can't manage and we end up in a state of exhaustion, then what will happen is we will ultimately end up with a decrease in blood pressure and a decrease in heart rate, but it's going to become so low that it's going to become quite ineffective, because something has to change in order to deal with everything being at that heightened state. And so then after exhaustion, we either have a recovery state or we have a state where the person will die. Okay, so we're hoping that we get the recovery state where the adaptation to that stimuli is successful and the person is able to recover. But for some reason, if a person stays in that state and we're unable to recover them to a state where homeostasis has occurred, then their body is going to exhaust and it will die. And frequently you see this in the emergency room, especially if you have an acute patient come in with like a gunshot wound or a stab wound or something like that, that the bleeding is too much to control. Okay. All right, so we also have something called the local adaptation syndrome, or LAS, LAS. So GAS is general adaptation syndrome and LAS is local adaptation syndrome. And frequently our bodies go through local adaptation syndrome where the response to stress is only in one part of the body. So best example I could give you, you cut yourself. You only cut yourself superficially, like on one side of your skin. As the skin starts to heal, it recovers and it's fine. You know, you don't have any problems. So in a localized state, you have a reflex response to pain because it hurts when that cut happens. And then you have an inflammatory response that ultimately ends up with that particular wound healing. Okay. Psychological responses to stress include anxiety and fear. You have the ego defense mechanism of denial, because many times people who are in a critical state, they'll be like, no, not me. You'll see people having an active heart attack and they'll say, no, I'm okay. Or a person who's choking and they're choking and they'll say, no, I'm okay. It's almost like this ineffective defense mechanism that actually take over. Sometimes you'll find people who are very angry about their situation, especially health situations, if they feel that, why me? Why did I end up with a diagnosis of cancer? And they'll get very angry about it. And many times that anger is projected on you, the caregiver, but you can't take it personally. And then frequently people who are diagnosed with chronic illnesses end up in a depression because life has changed for them so much. And so they have to constantly stay in a state where they are encouraging themselves so that they can successfully adapt to possibly a change in their physical and psychological well-being. Now, there are consequences of failed adaptation because sometimes people are just not able to get it together. And if a person fails at adapting, they're going to continually feel stress. Okay? That stress will result in repeated central nervous system stimuli. And so if you can imagine that our brains are unable to shut off because our brains is a part of the central nervous system, how stressful that would be. Person won't be able to sleep. Many times their eating is affected. They'll have the increased rise in cortisol, which of course is a stress hormone. And so all of those things long term can have a drastic effect on the body systems, and that's not a good thing. So some of the consequences of failed adaptation include somatoform disorders. Like the person may feel sick. And unfortunately, sometimes the person feeling sick, the providers can't find anything wrong with them. But this just goes to show you there's such a huge mental health, physiological health coordination in order for a person to be healthy, that sometimes you can't find a reason for it. And many times they may be considered as being malingerers, like they want the attention of it all, and that might not be. We also, with a failed adaptation, can have stress-induced psychological responses, which include a person going through a psychological crisis, or feeling burnt out, or having some sort of post-traumatic stress syndrome. And understand, post-traumatic stress syndrome is not only associated with people who come back from war. Imagine this, is that most of us are probably currently experiencing post-traumatic syndrome from COVID. None of us were used to living in an environment where you had to be inside, where you had to be isolated, where you couldn't see your family. I mean, there's been years since I've seen some of my family members, because many of them are so old. I would not want to possibly jeopardize their health by seeing them, because, you know, we know COVID is on the rise again. So think about all of the people who migrate to this country, who are refugees. When you turn on the TV and you see people crossing the border, you know, what physical state of health they must be in as they respond to stress, because that has to be incredibly stressful for them. So, of course, we would use a nursing process. So we have a patient that's undergoing some sort of stressful event. So we do an assessment of them. We're going to look at what their stressors are, what their risk factors are, what their previous coping abilities have been, and how well they've been able to adapt in the past. Because usually people who have a history of getting through something, you can get them to dial back and help them remember that, hey, yeah, life was tough at that point, but I was able to get through. And when people can recognize there is a way to success, then usually they feel more encouraged, more likely to try to reach a different state, as opposed to staying in that very stressful state. So we want to find out all those things about them, and in particular, find out historically how they were able to deal with stress. And then we'll take all of that information and we analyze it and come up with a nursing diagnosis. Many times that nursing diagnosis is going to look something like either effective ways of dealing with stress or ineffective coping skills, depending on what you're able to establish once you've done your assessment. And then moving on, remember ADPI is a nursing diagnosis, the nursing process. So then we're moving on to plan. So we're coming up with a plan with our patients. Can't say that enough. With our patients, where we're looking to reduce the strength and duration of the stress, where we're looking to relieve or remove the response to stress and help them get effective coping mechanisms. Now, sometimes that's not only a nursing function. Maybe we have to do a referral to a mental health therapist. And so we need to be open to that as well. If you're not being effective at it, then see if we can do a referral to a specialist who could really help the person. You want to have both short-term and long-term goals, because short-term goals really do help a person see that they can be successful fairly quickly. And we want that to happen. Versus if we're looking at everything a month later. A month is a long time to be in a stressful mode. So we want to be able to get them up to the point where they may be able to see that they can manage stress very quickly. With stress reduction interventions, because the next step would be interventions, our actions, then we want to talk about health promotion activities that we can encourage them to participate in, like adequate nutrition, proper rest, proper sleep, adequate amount of sleep, adding some exercise in their day, and teach a person how to cope. You know, it's very individualized, but sometimes you have to use very simple examples to get people to see that, yeah, I can manage that. You know, an example I would think of is this: if a person takes the bus to school or to work and the bus actually pulls off, okay? Yeah, you're stressed out because you're probably like, I'm gonna be 10 minutes late, or it's gonna take me 10 more minutes to wait. But the truth is, another bus is gonna come, right? So maybe the coping mechanisms that you help a person understand is just that. Give it a few minutes and it's going to resolve itself because there's another bus that's going to come. Okay. All right, so those are our interventions. And then, of course, we have to evaluate whether or not they are effective or not. And usually that's going to be a conversation, and a conversation that happens later, not right away, because it's kind of hard to reevaluate whether or not what you've talked about or the health promotion activities have worked or not. But if a person's inpatient in a hospital, you might set a goal that within 48 hours, the person will be able to identify 5 ways that they could better manage stress. And then they would tell you those 5 ways, and then that would be a success. But remember, as with any evaluation, if it doesn't work, so say, for example, using that example, and you came back 48 hours later and the person wasn't able to tell you one thing they would do to change to manage stress, then you'd have to go back to the drawing board and you'd have to do a reassessment to determine what that person's needs are and how you can get them to the point where they are able to gather some success. So that's it on stress and adaptation. Hopefully this was helpful to you. Remember that you have to take care of yourself, because it is totally understandable to be in a state of stress as you're going through such a strenuous nursing program. But remember this, you belong here. There were lots and lots of applicants that I'm sure came through your university, and you were chosen. And so sometimes when you're down on yourself or the grades don't look right, remember that you were chosen to be here. So it's up to you to do the work in order to stay here. So bye for now, and I'll see you next time.